The following is intended for a mature audience. Proceed with the understanding that taboo and offensive material will be discussed. The revolution must be non-violent, and it must occur in our minds, thus being the evolution we need to survive. The Evolution Revolution Podcast.
Hi, hello. This is the Evolution Revolution podcast on IMN. Today I am joined again by Lisa Savage, candidate for U.S. Senate in Maine. How are you doing, Lisa?
Very well, William. Thank you. Thanks for having me on.
Okay, so there's a lot of things going on in the world currently, but before we get into all those things, I do want to. So you were an official Green candidate,
I was.
Senate, and now you're an official independent candidate. Why don't you explain that to everyone real quick?
Sure. It's a little confusing here in Maine because what I really am is an unenrolled candidate. And the way that came about was this. I'd been a Green Party member for some years, and when Green Party national folks came to me this summer and asked me if I would consider a run for the U.S. Senate seat of Susan Collins as a Green under ranked choice voting, I gave it serious thought and decided that, yes, that it was a project that I could take on. And so I applied for ballot access as a Green. Now in Maine, our party is called the Maine Green Independent Party. And so when people register to vote, they see Green Independent listed on the voter reg card. If they don't wish to affiliate with any party, they're supposed to check a box called unenrolled. But this leads to a lot of confusion because many people will say they're independent, but they're registered Green, or they're really unenrolled, but they'll say they're independent. In any case, the rules for ballot access for a registered Green are draconian and virtually impossible to beat. Many candidates before me have tried and not been able to get on. The rules were roughly that you had to collect 2,000 signatures of registered Greens and have them certified by their town clerks between January 1st and March 15th. That's ice storm season here in Maine, and Maine is a fairly large state with few people, so the registered Greens are scattered around quite a bit. Also, this year, everybody was feeling the burn and wanting to vote in the primary. Last year, we had caucuses, or last election cycle, but this time around, they did a Super Tuesday primary for the first time. So that fell on March 3rd. So you can see the problem between getting Green signatures in by March 15th. As we approached March 3rd, it became evident that we had spent 900 hours of mostly volunteer, but some paid time to gather 900 signatures. We were averaging 1 an hour. And this was pedal to the metal, many dedicated volunteers in the field working. So we pivoted and I unenrolled from the Green Party or any party and reapplied for ballot access under those circumstances, which allow me until June 1st to get 4,000 signatures, so twice as many, but I could collect them from any registered voter in Maine. So our strategy was go out on Super Tuesday, sit outside the polls, and as people exit, ask them if they'll sign my ballot access petitions. So 100 volunteers fanned out over the state, and we worked the polls, and lo and behold, at the end of the day, we had a little more than 9,000 signatures. We're only allowed to turn in 6,000 of them. And we will be doing that soon, but it was quite a difference. I regretted unenrolling from the Green Party. However, I remain Green at heart, Green in my values, Green in my platform. And so I went from being a Green independent to being an independent Green, I guess you could say.
Yeah, and again, yeah, and it's really just as simple as that. Like 2,000 Green signatures. Like here in Arizona, we have quite a bit of registered Greens, but it's you're gonna get like 10 of them showing up to a meeting, and 900. That's impressive. That's impressive to get that much. But anyway.
So we're on the ballot, so on we go.
Very good, very good. Okay, so Chelsea Manning a while back attempted suicide, and it seemed like right after that the judge decided to release her from jail. Give me your thoughts on that whole situation.
Well, the fact that she'd been in jail for a year for refusing to testify to a grand jury in secret. She had always said, I'll testify to the grand jury, but I'm not doing it behind closed doors. So they had slapped her in jail for that, for contempt of court, and fined her. So like her fines are in the six figures. Every day that she was refusing, they fined her. And so she'd been in prison for a year. Now, we're talking about someone who was imprisoned and tortured by UN standards for about 3 years after, leaking some materials to WikiLeaks back in the day about war crimes that the U.S. had committed in Iraq and other, important, not sensitive material that wasn't endangering anyone to share, but basically letting the American taxpayer know this is this is where your taxes are going. So, I've stood outside Quantico when Chelsea Manning was imprisoned there, was being tortured by having clothing removed and being on suicide watch constantly and being woken up every hour or two to make sure that she was still okay. I've stood outside Fort Leavenworth in Kansas in support and in solidarity with Chelsea when she was imprisoned there. So I've been following her case for a long time. I'm very saddened that her mental state led to a suicide attempt. However, I'm very grateful that the judge ruled that a year of this kind of mistreatment of someone who essentially was a whistleblower. We're supposed to protect whistleblowers under this system, allegedly. And so I'm relieved that I believe that Chelsea's in the hospital now, as far as I know. And I've written Chelsea many letters over the years, and I know that many of us hold her close to our hearts and wish her the best and hope that her path forward will be a much healthier one, and one where she can do her work as a journalist.
So a while back, President Trump said that he said that that coronavirus COVID-19 COVID-19 treatment, all copays for that would be eliminated, but then the insurance industry came out and corrected that, saying no, only tests will be free of copays. And you're a strong advocate for a single payer healthcare, correct?
Indeed, I am.
Tell me how you think this applies, single payer healthcare applies to that. Just dissect it for me.
Yeah, thanks for that question. In a pandemic such as we're experiencing here with the coronavirus and the illness that it causes, we expose the real weakness of the U.S. medical system. It's a for-profit system. In my opinion, profit and healthcare don't even belong in the same sentence together. I think that a system where people with good paying jobs and good benefits have decent health care as long as they don't become too terribly ill, and that most working people, at least most of the families of the students that I teach, or most of my neighbors around here where I live in Maine, in the 2nd District of Maine, don't have adequate health care. They haven't had for years, and they just hope they won't be ill. Now that there's a very contagious virus sweeping across the world and sweeping, it's in Maine now, Portland, Maine's city clerk's office shut down today because of an infection was detected. Now the really deep cracks in this terrible system where the CEOs of those private insurance companies make $20 million a year, but yet a working parent with children at home can't afford the premiums for a bad health care plan that has such a high deductible and such high copays, they can't afford to use it. Now we see where that leads to in a public health crisis because, my health care is pretty good because I'm a school teacher. I have collective bargaining. My union goes to the mat year after year and negotiates for good health care for me. But people that do not have that kind of bargaining power are part of my community. They're standing next to me at the grocery store. They're sending their children to school. Many of the children at my school are being raised by their grandparents. It's not unusual at all. So, at-risk populations who have no access to proper testing or care if they become ill are a threat and a danger to their own families, their community, the schools, and other institutions that they, are part of. And that is a public problem. That is a group, collective, humankind problem. It is not something that's going to be solved by the market, and it's not something that's going to be responsive to a profit-driven governance of those companies that provide our health care. And our government seems to mostly be concerned with bailing out the stock market, but not with addressing a very serious, probably the most serious public health concern that we've seen in my lifetime. It's very scary, and I know a lot of people are feeling very vulnerable. We're all in this together. When they talk about herd immunity, well, the herd at this point has no immunity to the coronavirus. And I'm seeing predictions of up to 70% of people will eventually catch the virus. Some people will become very ill. Some people will die. It doesn't have to be this way. The first person that I heard of, one of our campaign volunteers that worked Super Tuesdays, took his wife to the emergency room. She's fairly young, in her 30s. She had a high fever and a cough, and it was a couple days after Super Tuesday. He took her to an emergency room in Portland, Maine, and they were and wanted to be tested for the virus. They have children at home, young children, and we're told, we don't have any testing kits. Just go home and self-quarantine and hope for the best. This is the richest country in the history of the world, and we don't have any tests for the virus. It's a bad system, and it's likely to come crashing down around our ears right now in the midst of the time when we really need it to be strong for us and meet our needs collectively.
Mm-hmm. So you're a school teacher. What have you seen? What have you seen that might be affecting schools in Maine? I mean, due to the virus.
Oh, everything's being canceled. The spring sports season is pushed off for a month. All the gatherings, I'm on an email list where I get email about GLSEN events. They were going to have a couple big events coming up. That's canceled. The big Literacy Connections conference is canceled. My prediction, the Maine Department of Education issued a waiver today, meaning we'll let you off. You don't have to observe these rules for, because of certain circumstances. And what it was about was, if you're part of federal feeding programs that go in the summer when school, many of the children here in Maine receive most of their meals at school, and they experience food insecurity at home. So there are at least 45,000 children in Maine, in Maine growing up in poverty. If the schools close, then where will they get their meals? So the Department of Education was saying, you're allowed to use your federal funding for feeding students to deliver off-site meals. You can still feed people off-site. Normally that wouldn't be allowed. It has to happen there in the school building. But we're going to let you do that. That's a clear sign to me that they're thinking about, it's not a matter of if they're going to close the schools, it's a matter of when. And I really worry about the children and the families. Once children aren't being cared for during the day, how will their parents work? That will affect many families in my area who are just kind of, one tiny little margin away from complete economic collapse as it is, working multiple jobs that barely pay minimum wage, don't have any benefits, no paid sick leave. I could not believe that our Senator, Susan Collins, stood by and let the GOP leadership of the Senate block a vote on a bill that was introduced, an emergency bill guaranteeing every American 14 days of paid sick leave and having the federal government subsidize that. That's the least we should be doing right now. And the GOP leadership wouldn't even bring it to a vote. Did Susan Collins stand up as the moderate who works both sides of the aisles and say, no, I'm worried about my constituents in Maine. We need to do this? Nope, she didn't say a word. Very, very disappointing.
So, in addition to single-payer healthcare being put forth as a solution, one of the solutions to this pandemic, there has also been talk of universal basic income being being a tool to combat the virus. What is your take on that?
I think that's a very good idea. As I mentioned, once schools are closed, many parents will not be able to work. People that have professional jobs that are largely done online will probably still continue working from home. I have family members that are already working from home, but people in the service jobs, the sort of gig economy, if you will, those jobs can't be done virtually. They are done in person. And if you can't afford to not show up at work, you not only are losing income that you need to pay your rent or, keep a roof over your children's heads and some food in the refrigerator, but you're also going to probably get fired if you do not show up for your job. So universal basic income, again, it's for the common good. It's not just for the benefit of some individuals, it's for the benefit of us all. And I think it would be a very wise move at this point. I also think that some really deep thinking needs to be done about the many, many, many people that are incarcerated in this country for trivial reasons, completely nonviolent crimes, victimless crimes. Many low-income people are in jail because they cannot pay either the bail bonds fees or the fees, for whatever small time, infraction that they committed. Those people should be released immediately because, places with lots of people coming together, such as prisons, schools, the museums are shutting down. Really, any institution that can allow people to go home and practice social isolation to try to slow the pandemic. It's not going to stop it, but we could, as they say, flatten out the curve so that the incidence of cases doesn't completely overwhelm our rather inadequate healthcare system and completely swamp our healthcare workers. They too are service workers. They often are not necessarily very well paid. And we're seeing in the countries where the pandemic has already swept through, healthcare workers are become exhausted. There aren't enough of them and they're working around the clock. So I think that we need to look out for the more vulnerable members of our society and, take emergency measures. This is what government is for, to take care of people. I pay a lot of taxes out of my teacher salary every year. I don't mind paying taxes if it's going to take care of people and take care of us all. What I really resent is paying taxes and then having well over 50% of it spent on the Pentagon and its fat cat contractors every year. That's why we can't afford Medicare for all. It's a bad set of priorities in our budgeting. It's not that we literally can't afford medical care. Every other wealthy nation in the world has single payer public health care. We're the only ones that don't.
You bring this to an excellent point about government, and I was just wondering if you have any ideas, because again, the government seems to be failing, like as Italy has failed in terms of addressing the virus. What do you think could be done by just citizens working together, since it seems like the government isn't doing that well of a job of addressing this issue?
Well, there are certain things that citizens can do. We can form mutual aid societies where we stay in touch, help each other out, share what we have, share information, take care of each other. And hard times often bring out the best in people in that way. I'm already seeing a lot of evidence of that across the country and here in Maine. And I'm confident that our community, certainly my campaign team of, roughly 100 people here in Maine, we look out for each other. We will help each other. I'm sure a lot of bartering will start to occur where people will share toilet paper if they have it in order to get something that they don't have. But, there's only so much citizens can do. I cannot fill the scores of empty positions at the Center for Disease Control. That is the failure of our executive branch of the federal government. They underfund health, public health entities like that, shaving dollars off there so the Pentagon can spend some more money building weapons. And then when we have a crisis like this, that short-sightedness and foolhardiness is exposed. And
they purged half, I think it was half or close to all of the pandemic experts.
Because why would we have a pandemic? They've only happened repeatedly in human history. I read something. The other thing that we really need to do is put the scientists and the public health officials in charge of our response as a nation, because I can talk about something like this, but there are people that have spent their entire lives studying and learning and cooperating with others and figuring out what to do about this. I know how to communicate with people and say, let's not give in to fear. Let's pull together. Let's believe that we will get through this together, and let's share what we have, share our knowledge, share our expertise, and do the best we can. But the state government and the federal government, I'm glad I live in a state like Maine. We used to have a terrible GOP governor who also gutted social services, healthcare. He blocked our getting Medicare funds for years. But now we have a better administration here in Maine that I feel confident will take. Sometimes we're winning, sometimes the viruses are winning. I don't think that our chief executive of the United States has the mental capacity to understand that statement and to realize what his role, his proper role, would be in a public emergency of this type.
So have you taken a look into the amount of recorded cases of COVID-19 in Maine?
We're only just now seeing the first reported cases. Yesterday, the governor announced the first case. And then just now, one of my campaign staff who's in Portland texted me that the city clerk of Portland had closed down because of an infection had been recorded. So this is the tip of the iceberg here in Maine. Every other New England state already had reported cases, and Massachusetts was already in a state of emergency. We're very, very close. These are relatively small states, and there's a lot of travel back and forth between all the New England states. So it was clearly just a matter of time before it came to Maine. I have family members on the West Coast in the Bay Area. Two of my family members are nurses that work in hospitals in San Francisco. One of those hospitals is taking in the patients that came off the cruise ship that was moored in the San Francisco Bay for a long time with, the virus raging through it. So it's a national emergency, coast to coast. Last night I did a fireside chat with Dr. Jill Stein. It's been great having Dr. Jill as a senior advisor to my campaign because she's from a medical family and has good information. But while we were chatting, there was a woman from Washington State who's an ed tech, a paraprofessional in the schools, and she commented, just got notice that our schools will be closed for 6 weeks. Washington State, which, as we know, has been very hard hit and is ahead of New England in terms of how the infection has spread. So I think we're in for a wild ride. And my campaign has put out statements that just this afternoon about what policies we're recommending, and certainly we have suspended any face-to-face, in-person campaign events. We were going to have a big volunteer celebration tomorrow in Portland to thank the people that worked so hard on Super Tuesday. Now it will be a conference call. We won't be having nachos, unfortunately. And we just need to be flexible and be good problem solvers and listen to each other, even if we can't hug each other, kiss each other, handshake. Like we might want to, the biggest act of love, the greatest act of love is to listen to someone. And we can still do that.
Mhm. Well, it's been a pleasure having you on. You can find lots of info about Lisa's campaign on her website, lisaformaine.com.
It's
And
.org, actually.
or .org. Okay, sorry. Yeah,
Yep, that's it.
lisaformaine.org.
That's
And
right.
your handles for your social media are
Lisa Fermain.
okay.
Yes, Lisa Fermain. And the 4 is spelled out. It's not a digit. It's FOR. And some people may not know, Maine has an E on the end. So it's lisaformaine.org. Thank you, William. It's been great
Thank
talking
you.
with you.
Peace
Be
out.
well.